clearly it is my job as a veterinarian to let my clients know what the situation is likely to be, what the prognosis is, what the likely time course is. And also, I always like to put down some guidelines about when we need to be thinking about rechecking their dog or cat so that they don't sit at home feeling worried and feeling that they can't contact me. If you've got a large breed puppy or younger dog, then you likely know that you need to be aware of certain conditions of the bones and of the joints, and that's things like osteochondrosis, dissecans, panosteitis and arthritis later on in life. But one condition that you might not be aware of, and I think you should be, is something called hypertrophic osteodystrophy. But don't worry, it's not nearly as complicated or potentially serious as you might think.
Welcome to Call the Vet, the show that answers all your dog and cat questions so they can live healthier, happier lives. And here's your host, veterinarian Dr. Alex Avery.
Hello, and welcome to episode number 65 of the Call the Vet show. I can hardly believe that we've had that many episodes already. And if you've not listened before, if you've not caught any of the previous 64, then let me introduce myself. I'm Dr. Alex. I'm a veterinarian, a companion animal veterinarian, and I have been doing this job since 2006, which is a long time when I think back. But I'm here to help you look after your pet to the best of your ability, whether you've got a question about how to keep your dog or cat as healthy as possible, or whether they're unwell and you're wondering what on earth's going on, or what you should do to investigate their problem or to treat it. I'm here to answer all of your questions. So if that sounds like a show you're interested in, make sure you hit that subscribe button so you don't miss out on any future episodes. And if you are listening regularly and you've been here before, then I appreciate you so much. Thanks for joining me again for another fantastic question and a very interesting answer. I'm sure you'll agree. And just before we get into the meat of today's show, I just wanted to let you know that today's episode is brought to you by my free guide, The Pet Health Essentials. So these are all of the things that you need to be aware of, whether you've got a dog or a cat, to help prevent some of the most common conditions that I see every day in the veterinary clinic. A few targeted steps is all it takes to make a massive difference in your pet's health. So if you want to get your hands on that free guide today, just head over to ourpetshealth.com/petcareguide and you can get your hands on that, digest that and start making a real difference in your pet's health. So let's jump into today's question, and it was sent in by Yoda, who writes, my Rottweiler puppy is 11 months old, and about 5 months ago the vet here said he had HOD, or hypertrophic osteodystrophy, so he started on treatment with carprofen. He got better. Now, since a week ago, my pup is showing discomfort while sitting, so the vet here asked me to start carprofen again for 5 days. My pup is still feeling discomfort while sitting, and I feel I'm not getting much help from the vets here. Can you please help me with his situation? So it's a great question and certainly worth reaching out and asking about, because we don't want to just give a medication, give a treatment and assume that that's going to work as well as we would like it to. We shouldn't think that actually there's not more follow-up needed. And yeah, that's absolutely the case potentially with Yoda's young Rottweiler puppy. But it also helps to understand what the condition is so that you can be realistic maybe about what to expect with treatment and know what the course of the disease is likely to be, which clearly is my job as a veterinarian to let my clients know what the situation is likely to be, what the prognosis is, what the likely time course is. And also, I always like to put down some guidelines about when we need to be thinking about rechecking their dog or cat so that they don't sit at home feeling worried and feeling that they can't contact me. So let's start by answering this question with really discussing what hypertrophic osteodystrophy in dogs actually is, because understanding this disease is really important. So we've got a young Rottweiler puppy, and this disease is absolutely a disease of young, fast-growing, large and giant breed dogs. So these are dogs, Rottweilers as well, but Great Danes, Boxers, Labradors, Retrievers, and it's unfortunately a condition that's particularly severe in Weimaraners and Irish Setters, which I'll come on to a little bit later in today's show. Another word or another name for hypertrophic osteodystrophy that you might have come across is metaphyseal osteopathy, which is maybe a more accurate name, but either way, people will know what you're talking about, and they're two names for the same condition. So normally this is first seen in puppies between the age of about 2 to 8 months. So with Yoda's dog, 11 months old now, but 5 months ago had the first problem with this, which absolutely fits in with that. It's also male dogs that are more likely to suffer from HOD rather than females, although females absolutely can be affected. And really the condition, so it's characterized by really observable swellings at the ends of some of the long bones, so the radius and the ulna in the foreleg and the tibia in the hind leg. So that's to say the ends of the bones really are the ones that are swelling rather than the middle or the main shaft of the bones. That's relevant because there are other conditions which maybe can be causing pain in the main shaft of the bones, and that one is something called panosteitis, which is also a condition of young puppies, young dogs, and large breed dogs are slightly more likely to be affected with that as well. So going back to hypertrophic osteodystrophy, the cause is actually unknown. There have been various suggestions historically about what could be causing it. So vitamin C levels, because it's really quite bears some quite good similarities, or quite close similarities, I should say, to scurvy. Vaccination, especially distemper vaccine, has been implicated, although none of these have been actually proven to be the cause or proven to be the case when they've been investigated further. But it's definitely something that you might read or you might find kind of in your searches on the internet. But there's we don't really know what the cause is the bottom line. Likely genetics plays a role as well, because of the severity with different breeds. So the Weimaraner and Irish Setter, the fact that they're worse compared to other breeds, says genetics likely plays a role as well. And what happens with the disease is that you actually get reduced blood flow to the ends of these bones. And these are the areas which contain something called the growth plates in young dogs. And that's where all of the growth of the skeleton comes from. And what this reduced blood flow causes, it causes a reduction in or a delay in bone formation. And it can also result in inflammation or even death of the bone in this area. Now that's something it's not death of the bone to such a degree that you get really serious fractures in the vast majority of cases, although there are a couple of descriptions of cases where that has happened. But it's ultimately a very painful condition, which really means we can then move on to what the symptoms are. And you won't be surprised to hear that lameness is the main symptom. And that can really vary from a mild lameness to really severe, debilitating lameness where it's so painful the dog simply can't move because it just really, really hurts. You get swelling of the legs next to the joints that are involved. So it often actually does involve all four legs, but it's more noticeable in the front legs. And if it does only affect the front legs, for example, then normally it's symmetrical. So it will be both front legs rather than just one. You also get, as well as this lameness, systemic involvement. So the rest of the body becomes infected. You get a temperature, pyrexia, which is unsurprising given there's a load of inflammation going on in the bone. We get anorexia, so a dog will go off their food because ultimately it really hurts, and they're running a fever and they're not very comfortable. You'll get pain. They may arch their back. There may be a reluctance to move. So it's not just a little bit of lameness. It can have massive consequences with the rest of the body as well. We could get a couple of different forms. So we can kind of have a mild form where it's just a really mild lameness. It's pretty transient. It doesn't last for very long. Doesn't, and it's maybe even not noticed. You get an acute form, which again is transient. So it does tend to go, which again, I'll come on to later. It can potentially be episodic. You get low grade lameness and you get that pyrexia with hot, swollen, painful limbs. And then you could get something called a per acute case where, and these are the really severe ones. These are the dogs that are really unwell. So they're lethargic, they get dehydrated, they get severe pain when you're feeling around the affected area. They're the really sick dogs. So, from all of the things that I've described, really, if you've got a dog that's coming in, they're the right breed, they're the right age, maybe they're male rather than female, they've got the right history and symptoms, you're going to have a really strong suspicion that we're dealing with hypertrophic osteodystrophy. But there are other potential causes that obviously your vet is going to need to consider. It may be that further testing needs to be done, and that's things like panosteitis. So that's that condition where there's pain in actually the main body of the long bones rather than the ends. But it can be sometimes quite difficult in these really painful dogs to actually determine and to find out where they're actually hurting, because they're so wound up. Their pain state is so severe that any gentle touch anywhere either is painful or they anticipate pain and react as though it is painful. So you can't always say, well, there's pain at the ends of the bones rather than in the middle. So panosteitis is a potential cause that could be confused. Septic arthritis is another one. So that's a joint infection. Now, that's less likely if it's involving multiple joints in different legs, but it's certainly possible. We could get rickets, which is a vitamin D deficiency. Osteomyelitis, which is a bone infection, and clearly trauma as well, although a good history is potentially going to completely be able to rule that out. Now, if we're looking at making a diagnosis, blood testing is generally pretty normal. You're going to see signs of inflammation, maybe a bit of dehydration if your dog is particularly severely affected, but blood tests are really generally pretty unremarkable. And then x-rays is where we can really make our diagnosis, because there are some classic changes that we can see on x-rays that really allows us to make the diagnosis of hypertrophic osteodystrophy. So this is all very well and good, but what I've said doesn't actually help Yoda and Yoda's Rottweiler puppy. So, what's the use of it? I think it's important with everything that we understand what a condition is, because if we can understand the background of the condition, what the causes are, how it is affecting the body, we can maybe understand better the treatment that we need to give and the prognosis as well. So, that's why I always think that it's good to give all of this information, because if we have more understanding, there's maybe less uncertainty or there's less stress when we're coming kind of face to face with these conditions. So we've already made the diagnosis. For argument's sake, what are we going to do to treat it? Well, we don't know what the cause is, so there's no kind of cure that we can give, but we give supportive care instead. So the main one is going to be painkillers, and the main painkiller type we're going to use is something called the non-steroidal anti-inflammatory drug class. So NSAIDs, you might hear them called or see them written down, NSAIDs. They're a very effective painkiller. They can help with pyrexia as well, and they're generally very effective. Now, there might be some cases where they're inappropriate. For example, a dog who's really dehydrated, because they can cause problems in that case with kidney problems and various other side effect potentials. But generally, the non-steroidal anti-inflammatory drugs do a fantastic job of improving the pain in our dogs. And then along with painkillers, we give rest, we give confinement. So we're not trying to over-exercise them. We're trying to help everything settle down, that inflammation settle down. Soft bedding is very important. These joints, or the bones around the joints, are really sore. So having that soft bedding will help take the pressure off that. Rehydration and nursing care is really important, especially for our really severely affected dogs. So that rehydration may need to be through intravenous fluids with a drip, and the nursing care may involve turning every couple of hours. So a dog who's really painful, they're not going to want to move, and we don't want them getting pressure sores or other problems like that. And in severe cases, steroids might actually be used where our non-steroidal anti-inflammatories aren't having the effect that we would like. And actually in some dogs, so in the Weimaraner, I believe there's been some research that actually says that maybe the disease responds better to steroids than our non-steroidal anti-inflammatory drugs. With that in mind, what's the prognosis? Well, in another study, having said that the Weimaraners maybe respond better to steroids, and that may reflect their type of disease. Remember, that's a breed that is more likely to be severely affected. But in another study with a relatively limited number of dogs, admittedly, they were treated with a range of different things. So no treatment. Some were given antibiotics, some were given antibiotics and steroids. Others were given antibiotics, steroids, vitamin C. There were a few different options there. There was no difference in the rate of recovery among those dogs, regardless of what treatment. So they do tend to get better, really, whatever we do. So that's why just that supportive care is really important. Now, most dogs, thankfully, will recover from hypertrophic osteodystrophy in 7 to 10 days. So although it may seem really severe, actually that recovery is also relatively rapid. Some, though, will relapse at a later date. So much like Yoda's Rottweiler in the question, has had a relapse. That is not uncommon. And some dogs may even suffer multiple bouts, of hypertrophic osteodystrophy with protracted pain, and those relapses may be weeks or even months apart. We also need to think that puppies with an affected litter mate, again, remember there's probably a genetic component, so you do often get multiple cases within a litter, but puppies with an affected litter mate are also more likely to have a relapse. So, that said, the vast majority of dogs will recover from these relapses as well, even if they have a relapse in the first place. And as they get older, they're not going to have this condition. Once they stop growing, it's not something that persists and stays with them into adulthood. Rarely, though, the damage to the ends of the bone will result in a bone deformity. So the bone will start to kind of twist and grow at an odd angle, and that can cause some pretty severe consequences with arthritis specifically, because we've got a really large breed, big, heavy dog whose weight's being transferred through a joint that's at a funny angle that it's not designed to cope with. So the chance of arthritis in that case is really, really high. And it may be that in those cases, actually corrective surgery, once growth has stopped, is the best way that we can treat the consequences of hypertrophic osteodystrophy. But I'd stress that's not really very common at all. And then finally, some owners will actually elect for euthanasia if the disease is particularly severe, and that pain can't be controlled and their dog is miserable. Then it may be that that's actually the kindest option. But again, it's not very common that needs to be followed through.
Get your questions answered at callthevet.org.
So that is hypertrophic osteodystrophy in a nutshell. I hope that helps answer your question, Yoda. Stick with the program. Keep your dog as comfortable as possible. Give your vet a call, see if there's any other painkillers that you can give maybe. But fingers crossed, everything should settle down pretty quickly. And hopefully at 11 months of age, there's not going to be another relapse, because a lot of that growth is going to have stopped. So also remember about my free guide. So if you've got a puppy, if you've got a large breed dog, a large breed puppy, but if you've got a dog or a cat of any age or any breed, then my free guide, Pet Care Essentials, is going to help you keep your pet as happy, healthy and comfortable as possible so they can live a full and happy life to their maximum potential. So you can get that over at ourpetshealth.com/petcareguide, or just head over to ourpetshealth.com and you'll see that there. Also, remember to check out the show notes, because there's going to be other links to related articles, and it'll dive into a few things in more detail. So you can find that over at callthevet.org. And as always, I really appreciate having you along with me. If you've got any questions, then hit me up on social media. I'm more than happy to answer any questions that you have, help clarify things. And remember, you can get your question answered as well at callthevet.org. But until next time, I hope you're staying safe. I hope you're staying well. I'm Dr. Alex. This is Call the Vet. Take care.
You've been listening to Call the Vet. Be sure to rate, review, subscribe, and we'll see you on the next episode of the show that answers all of your pet questions.